Have you noticed your hair getting thinner? Not dramatically, not all at once, just gradually, quietly. Over the last few years, the ponytail that used to be thick now feels like half of what it was. The part looks wider. The hairline feels further back. And every time you wash your hair, the drain tells a story you would rather not see. If that sounds familiar, you are not imagining it. And you are not alone. Hair thinning after 60 is one of the most common concerns I hear from women in my clinic. But here is what most of them are surprised to learn when they sit across from me. The thinning is often not about the hair itself. It is about what is happening on the scalp the night before. Specifically, what is happening or not happening while you sleep. Your scalp does its most important repair work between the hours of roughly 1000 p.m. and 2 a.m. That is when blood flow to the follicles increases. When cell division in the hair bulb accelerates, when the growth, signals that determine whether your follicles stay active or go dormant are at their most influential. Most women over 60 go to bed with a dry, untreated scalp, and those 4 critical hours pass with their follicles receiving no support at all. One drop of the right, the biggest nighttime mistake. Women make oil changes that, applied correctly to the right areas of the scalp before bed, it works with your body's natural repair cycle instead of missing it entirely. Today I'm going to tell you exactly which oil, exactly how to use it, exactly why it works at the follicle level while you sleep and what to combine it with to get the most out of those nighttime growth hours. This is not a trendy recommendation. Everything I share today is grounded in research I will explain clearly, and it costs almost nothing to start tonight. Let us get into it. Before I tell you about the oil, I want to make sure you understand what is actually happening with your hair. Because once you see it clearly, the solution makes complete sense. Hair grows in cycles. Each follicle on your scalp goes through a growth phase called anagen, a transition phase called catagen, and a resting phase called telogen. In healthy younger hair, the growth phase lasts 2 to 6 years. The resting phase lasts a few months. Then a new hair pushes out the old one, and the cycle starts again. After 60, several things shift. The growth phase shortens. Follicles that once spent years actively growing hair now spend less time in anagen and more time resting. The hairs that do grow come in finer and shorter than they used to. And some follicles begin spending so much time in the resting phase that they effectively stop producing visible hair altogether. At the same time, scalp circulation declines. The tiny blood vessels that understanding hair growth cycles feed each follicle carry oxygen and nutrients into the hair bulb, the living root of the hair. When circulation is poor, the follicle receives less of everything it needs to sustain active growth. It is like trying to grow a plant with inadequate water. The plant does not die immediately. It just produces less and less until it goes dormant. Hormonal changes compound this further. The drop in estrogen after menopause removes the protective influence on hair follicles. Estrogen prolongs the growth phase. Without it, follicles cycle faster and rest longer. And then there is DHT, dihydrotestosterone. As estrogen declines, the relative influence of androgens, including DHT, increases. DHT binds to receptors in hair follicles and progressively miniaturizes them. The follicle gets smaller with each cycle. The hair it produces gets thinner. Eventually, the follicle may stop producing hair at all. This is the environment your follicles are operating in after 60. Reduced circulation, shortened growth cycles, hormonal shifts that work against follicle activity, and a scalp that is often dry, tight, and undernourished. The oil I'm about to describe addresses several of these factors directly. Not all of them, but enough to make a visible and measurable difference when used consistently. The oil is rosemary oil diluted in a carrier, applied as a single drop or small amount to specific areas of the scalp before bed. I want to explain why rosemary specifically, because there are dozens of oils promoted for hair growth, and most of them have very little evidence behind blood flow, and hair follicles explain them. Rosemary has 2. The first is a 2015 clinical trial published in the journal SkinMed. Researchers compared rosemary oil directly against minoxidil, 2% of pharmaceutical treatment for hair loss, over 6 months in participants with androgenetic alopecia, which is the most common form of hair thinning. The result was that rosemary oil produced equivalent hair count improvements to minoxidil, at the 6-month mark equivalent to a prescription medication from a plant oil. The second is a 2022 study published in Dermatology and Therapy examining rosemary's mechanism of action. The researchers found that rosemary's active compound carnosic acid stimulates nerve growth factor in the scalp tissue, which in turn activates follicle stem cells. Follicle stem cells are the cells at the base of each follicle responsible for initiating new hair growth cycles. In dormant follicles, these stem cells have stopped receiving the activation signal they need. Carnosic acid appears to restore that signal. This is a meaningful mechanism. Not just improved circulation, not just better scalp moisture. Direct stimulation of the cells that initiate hair growth. Additionally, rosemary inhibits 5-alpha reductase, the enzyme that converts testosterone to DHT, the same enzyme targeted by pharmaceutical DHT blocking medications. Reducing DHT activity at the follicle level slows the miniaturization process that causes follicles to progressively produce thinner and shorter hair. 1. Oil, 3 documented mechanisms: circulation improvement, follicle stem cell activation, DHT inhibition. That is why rosemary, and not something else. Why rosemary oil works. Now let me explain the timing, because applying this oil before bed is not an arbitrary recommendation. It is specifically matched to your body's biology. Hair follicle activity follows a circadian rhythm. Research published in the journal PNAS, the Proceedings of the National Academy of Sciences, CIRC, confirmed that the genes governing hair growth cycles are regulated by circadian clock genes, follicle stem cell activity, cell division in the hair bulb, and the signaling molecules that push follicles into the active growth phase all peak during the nighttime hours. This is the window when your scalp is most receptive to growth-supporting inputs. When you apply rosemary oil at night, you are placing the active compounds on the scalp precisely when the follicles are most biologically active and most capable of responding to stimulation. The carnosic acid is present in the scalp tissue during the hours when follicle stem cells are most likely to receive and act on activation signals. Daytime application is not useless, but nighttime application is working with your biology rather than at a neutral time. There is also a practical benefit. Leaving oil on the scalp for 6 to 8 hours while you sleep gives it significantly more contact time with the scalp than a daytime treatment that gets washed off or disturbed within an hour or two. More contact time means more absorption. More absorption means more of the active compound reaching the follicle level, where it does its work. 1 drop at bedtime, 6 to 8 hours of active contact. Time to the peak of your follicle's natural activity window. That is the logic, and it is solid. Here is something I want to address directly before I give you the exact application method. A lot of women over 60 have research comparing rosemary oil to minoxidil, tried scalp oils before and seen very little result. And there is usually a reason, not because the oil was ineffective, but because of how it was applied, or where or what the scalp condition was before application. The method matters almost as much as the oil itself. Let me show you exactly how to do this correctly. Start with the right preparation. Rosemary oil is an essential oil. It cannot be applied undiluted directly to the scalp. Undiluted essential oils can cause irritation and in some cases chemical burns on sensitive skin. It must be diluted in a carrier oil first. The best carrier options for hair growth are jojoba oil and castor oil. Jojoba because its molecular structure mimics the scalp's natural sebum and absorbs without leaving heavy residue. Castor oil because its ricelic acid content supports scalp circulation, and its thick viscosity creates a sustained release effect that keeps the active compounds in contact with the scalp longer overnight. The dilution ratio 4:2, 5 drops of rosemary essential oil per tablespoon of carrier oil. For nighttime use specifically, castor oil is the better carrier because its thickness and elusive properties mean it stays on the scalp through the night rather than being absorbed or dissipated quickly. Now, the scalp preparation step that most people skip. If your scalp has a layer of buildup, dead cells, old product residue, dried sebum, the oil cannot penetrate properly. It sits on top of the blockage rather than reaching the follicle openings. Once a week before your nighttime oil treatment, do a gentle scalp exfoliation. Mix a teaspoon of fine sea salt into a small amount of conditioner. Apply to the why bedtime is the best time scalp with soft circular fingertip pressure for 90 seconds. Rinse thoroughly. This clears the follicle opening so the oil can actually get through. Now, the application itself. Section your hair into parts. Using a dropper or your fingertip, apply the diluted rosemary oil directly to the scalp, not the hair length. The follicles are in the scalp. Applying oil to the hair shaft does nothing for growth. Work systematically across the scalp, giving extra attention to the areas where thinning is most visible. For most women over 60, this is the crown area, the frontal hairline, and the temples. After applying the oil, spend 3 full minutes doing a scalp massage. This is not optional. Set a timer. Use the pads of your fingers, not your nails, and work in small circular motions with gentle but firm pressure. 3 minutes feels longer than you expect. Most people stop at 45 seconds. Why does the massage matter so much? A 2016 study published in the journal Epilasty found that standardized scalp massage over 24 weeks increased hair thickness and was associated with changes in gene expression in dermal pillar cells, the cells at the base of the follicle that regulate hair growth. The mechanical stimulation of massage sends a direct signal to follicle cells that activates correct dilution and application. Growth-promoting pathways. Oil plus massage, not just oil alone. After massaging, cover your hair with a loose shower cap or a soft hair wrap. This serves 2 purposes. It keeps the oil from transferring to your pillowcase, and it creates a mild, elusive effect that maintains the warmth and moisture of the scalp through the night, improving absorption. In the morning, rinse with a gentle sulfate-free shampoo. You may need 2 rounds of shampooing to remove the castor oil fully. That is normal and expected. Do this 3 to 4 times per week, not every night. Your scalp needs time between treatments to avoid buildup. 3 to 4 times per week is the frequency used in most of the research showing measurable results. The rosemary oil nighttime treatment is the foundation, but 2 additions can meaningfully accelerate what it does. The first is peppermint oil. A 2014 study published in Toxicological Research compared peppermint oil against minoxidil and saline in a controlled setting and found that peppermint oil produced the most significant increase in follicle depth, follicle number, and dermal thickness of all 3 groups. The mechanism is vasodilation. Peppermint's menthol compounds stimulate blood flow to the scalp significantly, delivering more oxygen and nutrients to the follicle at exactly the time rosemary's active compounds are working. Add 2 drops of peppermint essential oil to your rosemary and castor oil blend. You will feel a mild cooling or tingling sensation on the scalp after application. That is the vasodilation working. It is completely normal, and 3-minute scalp massage technique subsides within a few minutes. The second addition is biotin-rich foods consumed before bed. Biotin vitamin B7 here is a required coactor for keratin synthesis. Keratin is the protein that hair is made of. Without adequate biotin, your follicles cannot produce keratin at full efficiency, regardless of how active they are. And the nighttime protein synthesis window, when your body is doing its most active repair, is exactly when biotin availability matters most. A small bedtime snack of eggs, almonds, or sweet potato consumed 30 to 45 minutes before bed ensures your body has biotin available during the peak follicle activity hours. This is a minor dietary adjustment that most people would not think to connect to hair growth, but it directly supports the keratin synthesis process that converts follicle activity into actual visible hair. I want to spend a few minutes on this because topical treatments work on the outside of a problem that also has an inside dimension. Hair is a non-essential tissue in terms of survival priority. When your body needs to allocate nutrients, it gives them first to vital organs: the heart, brain, liver, kidneys, and last to hair and nails. This means that any nutritional shortage is felt in your hair before almost anywhere else. After 63, nutritional factors are most commonly linked to hair thinning in women I see in my practice. The first is protein. Hair is made almost entirely of protein. A low-protein diet creates a shortage of the amino acids needed for keratin production. Your follicles can be fully add peppermint oil for better results activated and ready to grow, but without adequate protein, the raw material for hair is simply not there. Aim for protein at every meal: eggs, Greek yogurt, fish, legumes, dairy. Not complicated, just consistent. The second is iron. Iron deficiency is one of the most common and most frequently overlooked causes of hair thinning in women. The hair follicle is one of the most metabolically active tissues in the body. It requires a consistent supply of oxygenated blood. Iron is what allows red blood cells to carry oxygen. When iron is low, oxygen delivery to follicles suffers. Growth cycles shorten. Hairs shed before their time. If you have not had your ferritin level checked recently, ask your doctor. Ferritin, stored iron, is a more sensitive indicator of iron status for hair health than standard hemoglobin alone. Many women have normal hemoglobin, but low ferritin, and low ferritin alone is enough to drive significant hair thinning. The third is vitamin D. A 2019 review in the journal Dermatology Online confirmed a significant association between vitamin foods that support hair, growth overnight D deficiency, and both hair loss and follicle cycling abnormalities. Vitamin D receptors are present in hair follicle cells, and adequate vitamin D supports the activation of follicle stem cells. Most women over 60 are deficient without knowing it. A simple blood test confirms your level. Supplementation is straightforward if needed. None of these require dramatic changes. A blood test from your doctor. Protein at each meal. These are small adjustments with potentially significant effects on how your hair responds to everything else you are doing. I want to tell you briefly about a patient I saw about 2 years ago. She was 68, retired. She came in for a routine skin check, but mentioned almost as an aside that her hair had been thinning visibly for about 3 years. She had tried a couple of over-the-counter products with no iron, vitamin D and protein deficiencies results. She had more or less accepted it as part of aging. We ran some blood work. Her ferritin was very low. Her vitamin D was borderline deficient. Her protein intake, by her own description, was modest at best. I suggested the rosemary and castor oil, nighttime protocol 3 times a week. Addressed the ferritin with dietary changes and a supplement. Got her vitamin D to an adequate level. Added a simple protein focus to her meals. At her follow-up 6 months later, she came in with noticeably more hair density at the crown. She said she had noticed new, complete nighttime hair, routine shorter hairs, at the hairline around the 3 mon mark. By month 5, her hairdresser commented unprompted that her hair seemed fuller.